Welcome to the Beach RN, education for registered and student nurses. Today we're looking at arterial blood gases, ABGs, and this is essentially looking at getting that delicate balance for our pH so that our hormonal and chemical reactions can occur. We're looking at the kidneys and the respiratory system and our various data points. Now, a note on the PaO2 and the SpO2. With blood gases, the PaO2 can help get an idea about the respiratory function. How well are the lungs working? And remember, there's 21% oxygen in the air and 3% of that is dissolved in the plasma. Now, of that partial pressure of oxygen, that enables the oxygen to diffuse across the alveolar membrane and then into the bloodstream, where 3% is dissolved in the plasma and the 97% is bound to hemoglobin and then delivered to the cells at the peripheries. So pulse oximetry gives us an idea on the tissue oxygen delivery. As I just said, the oxygen is bound to the hemoglobin. But remember, always observe your patient first. What's their cognitive state like? What's their level of consciousness? What's their capillary return? What's their respiratory rate and depth? Do they have a lot of accessory muscle use? Feel them. Are they cool and clammy? What's their cardiac output like? What's their blood pressure like? Let's look at some of the parameters. The pH is the acidity or alkalinity of the solution. And with our blood, anything below 7.35 is acidotic. Anything over 7.45 is alkalinic, which we call is a base. The PCO2 reflects a respiratory component of the acid-base balance. It's 35 to 45. Anything to the left is a base. Anything to the right is an acid. And bicarbonate reflects a metabolic component, and that's 22 to 26. Anything to the left is an acid, anything to the right is a base. If the blood is too alkaline from excess bicarbonate, the kidneys can retain hydrogen. If too acidic, they can excrete it. Likewise, kidneys are also involved in bicarbonate production. But with the kidney, any change can take hours to days. Our base excess base deficit reflects an increase in excess or a decrease of deficit in the total amount of base present to buffer the body acids. So it's -2 to +2. Anything over +2 indicates a metabolic alkalosis. Anything below is an acidosis. Now, looking at this formula, it looks complicated, but really helps us understand our blood gas results. We have CO2 plus water combines to form carbonic acid, which can be broken down into hydrogen and bicarbonate. The left is the lungs, the right side is the kidney. So we've got carbonic acid in the blood, and we're getting too acidotic, too many hydrogen ions. The carbonic acid can break down into CO2 and water, and we can blow the CTO off. Alternatively, we've got the hydrogen and the bicarbonate, and the kidneys can regulate that. Now, in terms of assessing the acid-base balance, we've got our formula. And remember, the lungs is to do with the CO2, the kidneys generally with the hydrogen and bicarbonate. And I'll put our normal ranges up here, which we've just spoken about there. Now, the process to go through working out what's going on is write down your pH, your PCO2, and your bicarbonate. Then determine if each value is an acid, a base, which is our alkaline, or if it's normal. And then simply circle the same letters of your results. And then assess for compensation by seeing if the uncircled variant is moving in the opposite direction. If not, no compensation is occurring. We've got an acute problem because the kidneys haven't had time to kick in. Let's practice. There's our normal values for you. They're handy. And then here's our steps. So write down those variables and then determine if each is an acid, a base, which is our alkaline, or if it's normal, and then circle the same letters. And then you can decide with your force point, see if compensation is occurring. Is the uncircled variant moving in the opposite direction? Well, let's have a practice. So you can take a screenshot of this later, and then you can go away and practice with other variables too. So we've got a pH of 7.5, a PCO2 of 29, and a bicarb of 24. Let's determine if each value is an acid or a base. So our pH is a base, it's high. Our PCO2 is a base, it's low. And our bicarbonate is normal. So we're going to circle both the Bs for our base, so pH and PCO2. Now, PCO2 is a respiratory component. So we have an alkalosis, a respiratory. The bicarb's not moving in the opposite direction, so there's no compensation. An example could be hyperventilation. We're blowing off too much CO2, perhaps with pain and or anxiety. Our next one is 7.5 is our pH, 49 is our PCO2, and 34 our bicarb. So we've got a base, an acid, and our bicarb is also a base. So we're circling both the B's, so our pH and our bicarb. So we've got something metabolic going on here, a metabolic alkalosis. And in this instance, the PCO2 is moving in the opposite direction. So we have some compensation. The lungs are trying to retain, and the instance might be too much Lasix, and we've had hydrogen loss through the kidneys. So we've gone alkalinic. We want to retain some of our hydrogen ions. Thirdly, pH 7.25, CO2 61, bicarb 23. So the first two are acids, they're acidotic. Our bicarb is normal. So we've got a respiratory acidosis going on here because we circle both those. Remember, PCO2 is a reflection of the lungs. And we've got an acidosis, no compensation in this instance. And an example of that, can you think of one yourself? Well, it might be a narcotic overdose where we're under breathing, hyperventilation, not blowing off enough CO2. So we've got the high CO2 there. Our final one, pH 7.15, CO2 is 30, bicarb is 10. So we've got an acid, a base, and then our bicarb is low, so we have an acid. So in this instance, because both the pH and the bicarb are the same acidotic, we've got a metabolic acidosis going on, and we can notice that we have some compensation. So an instance of this, a classic case would be your diabetic ketoacidosis with some partial compensation, trying to blow off the CO2. So take a screenshot of that if you like, get your camera out, and just remember that suggestions here are just that, suggestions. Always consult your clinical practice guidelines and always ask if you don't know. Thanks so much for listening and watching. This has been the Beach RN from the Mornington Peninsula, Australia.